Thank you. Good afternoon or good morning, everyone. Welcome to today's webinar on the OSHA's National Emphasis Program for COVID-19. I'm Scott Earnest, Associate Director for Construction in the Office of Construction Safety and Health at NIOSH. Happy to kick off the 19th webinar of the COVID-19 webinar series for the construction industry. We're excited to partner with OSHA today to hear more about the COVID-19 National Emphasis Program. Our panel includes Scott Ketcham, Director of OSHA's Directorate of Construction, as well as his Deputy Director, Tim Irving. After a few remarks from Scott, we'll hand it over to Larry McGowan, Supervisory Industrial Hygienist with OSHA's Directorate of Enforcement, for a presentation reviewing the details, policies, and procedures included in the National Emphasis Program. Following the presentation, CPWR's Executive Director, Cain, will lead us through some Q&A. We did receive a number of advanced questions during the registration process, and we'll focus on responding to those first, followed by live questions if time allows. And with that, I'd like to go ahead and pass it over to Scott Ketcham. Scott, thanks for being here.
You bet. Thank you, Scott. It's a pleasure to be here. Good morning, everyone. First of all, I'd like to thank you for inviting us here to be with you today for this webinar on OSHA's COVID-19 National Emphasis Program. Thank you, CPWR, for hosting this event. I'd also like to thank Cain and Scott Earnest also for all they do to protect construction workers, as well as all of you in the audience with us today. I know this is all a core value that we hold at heart, and I want to thank each of you for the hard work you do every day to ensure people go to work and come back in the same condition every day. Thank you. I hope your families are well as well in these times of uncertainty involving COVID. I hope that this finds you and your families well. Over the past year, we've all been affected by COVID-19, and my hope is that you and your families are well and your workers are well. We have met several times in this time to discuss guidance both from OSHA and other partners for solutions on protecting workers against COVID-19 hazards. As you know, we are focusing our policies in accordance with the President's executive order to further reduce the hazards of COVID in the workplace through proactive means, proactive actions such as the issuance of strong guidance, emphasizing workers' rights, and emphasizing anti-discrimination protections in late January, as well as the COVID-19 National Emphasis Program and the consideration of an emergency temporary standard. I want you to know that I've served with OSHA as a safety and health professional for over 30 years, and my commitment, as well as my colleagues in OSHA, has never been stronger to our nation and the safety of our workers. I know things are tough with the COVID-19 pandemic hurting so many Americans and worldwide, but we will make it through this pandemic with vaccinations, procedures, training, and use of our collective knowledge in developing protective measures. We are all making the construction workplace safer. In addition to protecting yourself against COVID, it is important that we bring up there are other hazards in the construction industry as well that we need to be considering. Falls, struck by, caught between, and electrocution hazards still account for approximately 60% of all fatal incidents in construction. Let's keep that in mind as we plan our work processes and begin our workday. On that note, I would like to let you know that forthcoming on both issues of struck by and falls, we are participating along with CPWR and NIOSH on a national stand down to prevent struck by incidents on April 26th, hosted through CPWR, NIOSH, and NORA. And the fall stand down in May 3rd through the 7th. And I hope you can join us on these important outreach endeavors to prevent these types of incidents and tragedies from happening. I want to point out that together we can make a difference, we can prevent injuries, and we can save lives. Let's do all that we can to send every worker home safe and healthy at the end of each and every day. Joining me today is my Deputy Director, Tim Irving, and Larry McGowan of our Directorate of Enforcement Program, who has prepared a presentation on the COVID-19 NEP. We will take questions at the end of this presentation, and thank you very much. Larry?
Okay, Thank you very much. I'm with the Directorate of Enforcement Programs in the Office of Health Enforcement, and I'm going to talk to you about OSHA's National Emphasis Program for COVID-19 that we launched in March. And as you all know, the President, on his second day in office, issued an executive order, and Scott kind of highlighted these things in his directive to the Department of Labor. He wanted us to issue some revised guidance, and we're always looking at our guidance and trying to be in concert with the CDC and the FDA. And I'll talk about that toward the end of the presentation. And also to consider an emergency temporary standard for COVID-19, which we've been looking at for the past year, and we're re-looking at it again. And so that hasn't gone forward yet, so I can't really talk about that other than what you already know, that we're looking at it. And to evaluate our enforcement efforts and develop a national program. And so the National Emphasis Program is what came out of this third bullet. And he also is very concerned about vulnerable workers, disadvantaged workers, workers being retaliated against by their employers. So that is a component of our National Emphasis Program. But as far as an introduction, I wanted to just summarize our enforcement efforts over the past year. And we constantly, we're daily looking at these numbers. We're looking at what industries the numbers come in as far as complaints and employer referrals, fatalities. As you know, most of these are in healthcare. There's a significant number in retail. There's a significant number in construction industry. We get a lot of complaints. And we look at a lot of these complaints we open inspections for. So a quick list of some numbers, 17,000 complaints or employer referrals so far since the beginning of this about a year ago. And most of those are about 3,000 of those are in healthcare, about 1,700 of those are in the retail industry, 400 of those are just in the construction industry. So that's a significant number. But we have done a lot of inspections as well. We've done over 2,000 inspections over the past year, and we've done 30 inspections in the construction industry. Citations, we've issued some citations. As you know, the applicable standards without an actual COVID standard, we're just enforcing our PPE standards, our some cases respiratory protection standards, sanitation standards. We have record-keeping standards for employers reporting hospitalizations or deaths that are workplace related. And we have medical access records, and we have signage records requirements. So those are the standards we're enforcing, and in some cases we will issue a citation against the general duty clause as well, because employers have a responsibility to ensure a safe and healthy workplace. And if they're following guidance that's available and the employer is aware of the guidance, such as from the CDC, and there's industry-specific guidance, if employers are disregarding this guidance or not considering these measures that can protect workers that are well established, such as wearing PPE, such as separation, such as not screening workers or not reporting, having your workers not report to work if they're sick. These are all well-known guidance that employers should be implementing. And so that, and in some cases, we do issue citations for the general duty clause. So on March 12th, we decided to issue this National Emphasis Program to basically continue our enforcement efforts and add a targeting feature, and we'll talk about that. But basically, we've looked at how many inspections we've done for COVID over the past year. And we wanted to set a target to keep that high number of COVID-related inspections going until we get through this pandemic. We have an annual posting by fiscal year of OSHA inspections on our public website. And if you look at that number that was recently posted for FY20 from October of 2019 through September of 2020, we did almost 22,000 inspections overall, OSHA did, federal OSHA. And that number is down 35% from the previous year for fiscal year 19. And part of that is related to COVID. It took a lot of our resources. We were addressing a lot of complaints. We were unable to do a lot of the programmed inspections for the other national emphasis programs and local programs. But you'll see in that number also the fatality inspections were 1,500 last year compared to less than 1,000, up 65%. And that's a lot related to COVID. So our fatality inspections went up, our total inspections went down. If you look at those numbers for FY20, the inspections were COVID related about 1,100, and that was 5% of that 2,100. So that's how we developed our targeting goal for the NEP. We want to keep that 5% going, and we're continuing to do 5% just responding to complaints and fatalities. But as the pandemic eases, those numbers, we expect them to come down as more workers are getting vaccinated. And healthcare especially was prioritized. They were getting vaccinated in January. And so we should be seeing decreases in complaints. So then we add these programmed inspections to target certain industries, and I'll talk about how we targeted those industries. So we also, as I mentioned, we want to get the industries that put the most number of workers at serious risk. And we did that in a couple ways by looking at our past year's data. And we also want to prevent retaliation. So those are the two focuses. And we also have a significant continuing our outreach to employers. Our local offices are doing outreach. Our national office is doing outreach. We're doing outreach right now. So small employers, we have compliance assistants. So all those are continuing. As guidance changes, we're updating our guidance and giving that information out. So these three priorities, as I mentioned, the unprogrammed inspections are the complaints, employer referrals, the fatalities that we're responding to. As those numbers drop, we're going to keep the 5% of inspections as our goal. Follow-up inspections where we went last year. Sometimes we did remote inspections and we weren't able to go to the facility, and we want to follow up with them with an on-site inspection. And then we'll continue doing programmed inspection to keep the number at 5% using these target lists that we're going to develop. So a quick graphic here of the timeline of the NEP issued March 12th. March 26th, 2 weeks after the NEP, local offices can do their targeting now if they have reductions in complaints. But they're able to do programmed inspections, and we prepare these targeting lists at the national office. The framework is developed, and the area office can pull out establishments in their local jurisdiction meeting the criteria in the NEP. And then state plans are strongly encouraged to adopt this NEP, but they're not required. Some states already have their emergency temporary standards or full standards, and they may not want to adopt the NEP. So they have to notify OSHA within 60 days by May 12th, whether they're going to adopt it or not. And if the state plan does adopt, then they have within 60 days to submit documentation of their policy. Now, the NEP is paired with another document, our enforcement guidance, which we issued enforcement guidance. As I explained earlier, we're issuing guidance to enforce the applicable standards of sanitation, PPE, record keeping, sometimes a general duty clause. And we issued that back in April and then updated it in May. And we updated it now along with the NEP. And so that guidance was issued in a memorandum also on March 12th. And it gives a little bit of changes from the May 2020 guidance, and that there is more focus for on-site inspections, and there is more focused for the widespread extent of this hazard, not just high and very high risk procedures in healthcare, but also any place where workers are in close proximity, either with the public or coworkers, because we know that we're learning more that COVID can transmit through the air by just speaking, or it's important for the face coverings and in some cases respiratory protection, partitions. All these measures are updated in this enforcement guidance. And so I did mention that the priority is to do on-site where we can, or a combination of on-site and remote. So we may open inspection remotely and then go on-site after the opening, or we may just do interviews remotely via video phone or phone. So we want to keep our compliance officers safe, but we also want to get into the facilities to look for the hazards, or get into the work sites to look for the hazards. Let me advance here. Now, okay, so now we're going to talk a little bit about how we're targeting these industries. And as I mentioned, we looked at our enforcement activity for the past year. And we also looked at respiratory illnesses that were recorded in the calendar year of 2020. So we have developed an appendices of NAICS codes. And what we did is, for the enforcement activity, we looked at our categories of all enforcement activities, not only complaints and inspections, but also employer referrals, violations, hazard alert letters, and all these categories. We took the top 10 industries and we identified mostly healthcare, and we listed an Appendix A of the NEP, 11 healthcare NAICS codes, including hospitals, doctors' offices, physicians, dentist offices, where they were possibly not having high inspections, but they were high in the numbers of complaints received. And we also had specialty hospitals, rehab hospitals, so 11 different NAICS care, and nursing homes, can't forget them because they were probably the highest number. And then we also collected 10 NAICS codes that were non-healthcare: retail, warehousing, restaurants, grocery stores. So all those had either high inspections, violations, employer referrals, or in those 6 categories. So anyway, when we target those, we generate a list of establishments meeting those NAICS codes, and we randomize that list, and the area offices targets off of that list. Now, some of these industries are so small, and they would overwhelm our targeting list, like offices of dentists, restaurants, because even fast food restaurants, they would just overwhelm our targeting list. So we're not specifically targeting them on our prepared list, but we will respond to them with complaints, possibly opening an inspection if the complaint seems like the employer is not responding the way we want. And then we also looked at another list from the Department of Homeland Security, critical industries. And that's where construction kind of falls in. We have this supplemental list of about 32 NAICS codes. And the Postal Service is under this category. And these are critical industries that work throughout the pandemic, pretty much. And they are recognized by the CDC as critical industries. So if we don't have enough targeting from the Appendix A list, when we prepare a targeting list, we'll pull from Appendix B. Those are supplemental NAICS codes. So, and also with all of our NEPs, the local office can use their local knowledge of how they want to target and add an establishment in their local randomized list based on local knowledge, such as high numbers of complaints or past enforcement activity. So construction work site activity can get into a targeting list in that manner. So you're not on the primary radar, but you still can get on the radar in the construction industry. And it's just that's been the way it has been throughout this whole past 12 months. So that's it. This next slide kind of gives a graphic. It's kind of complicated, but the Appendix A is based on our enforcement data, the 21 NAICS codes, mostly healthcare. Appendix B is those critical workers where construction comes in. And so the local offices can create a master list of establishments. Also, small establishments are included because this is a health-related NEP. We are limited on safety violations at small establishments by our appropriations. And then this second list is based on the illness rate. Employers are required by March 2nd of every year to submit to OSHA their 300 log data. And so we've looked at that data and we've picked the highest establishments with a high illness rate greater than 10%, which indicates that most of these are probably related to COVID. It's not definite, but we know it's, and we can look at these industries and we could see most of them are in healthcare. So we know these are probably related to the COVID. So the local office can use this targeted rate based on past illnesses for calendar year 2020, or they can use this fiscal year 2020 enforcement data as their list, or they could use a combination of them. The goal is to keep at 5% through the next 12 months. And then after 12 months, we'll see where we are. We may cancel the NEP if the pandemic ends, hopefully, but we may continue it. So that's it about the NEP, and we can take some questions. We got some questions in advance through CPWR, and we can get some chat questions here that if you have more questions about the NEP. It's just been a month now. We haven't had a lot of inspections opened yet under the NEP. As you know, we have 6 months between opening an inspection and closing and issuing citations. So we don't have a whole lot of data to show you on the NEP itself. But we're starting to track them and look at the data. Now, the second component that the president asked us is to look at updating our guidance. And we did in January. We issued an updated guidance on our webpage, and we're looking to update additional information on our webpage. So keep looking at our website. Also, besides the CDC, OSHA has a lot of information, and we're doing, as I mentioned, outreach like we are today, compliance assistance. The revised guidance takes a look at the key things that employers should be doing a hazard assessment like they do for other hazards on their work site, and look at what measures they can do specifically for COVID-19. And looking at, how your vulnerable workers are impacted, and can they understand all this guidance, or is there, OSHA's website, you can click the corner and change it all into Spanish, and a lot of our publications and guidance are also in additional languages. So we do try to address the multilingual employees too. And then the key guidance here is talking about sending home infected or potentially infected folks from the workplace, or not letting them come to the job site, trying to do keeping physical distancing, wearing face coverings, using personal protective equipment as needed. And we are constantly working with NIOSH, the CDC, the FDA, the USDA on all the information that the government can put together to address this hazard. And it's changing. There's new variants of the virus coming along, and we're not sure if the vaccines are going to work against these new variants, but we think in some cases they will. So it's all a pretty fluid situation, as you know, and we're working to adjust our guidance and our programs as we go along. So this is our website, and all the federal governments use this same /coronavirus to identify their latest information about COVID-19. So if you have any questions, Scott and I and Tim are ready to answer. And I think Chris is going to send us a couple now.
Thanks, Larry. I appreciate you presenting, and I appreciate Scott and Tim joining us from OSHA as well. We do have a number of questions, some that have come in through the chat and others that were sent in during the registration process. And I'm going to go ahead and ask a few of those now. So the first one is, will proof of a COVID-19 vaccination be required at a place of employment and or job site?
Thanks, Chris. I'll take that one on. This is Scott. We encourage employees and employers to get vaccinated, but it is premature to project future policy for proof of vaccination at the federal, state, or local level at this time.
All right. What about, has OSHA said for employers of essential workers the options for requiring vaccines? Is there anything else that you can say on that? And lots of states are now completely opened and are offering vaccines to all people. So I don't know if you can respond to that further.
I can add a little bit to that, Scott, if you want. I mean,
Please.
OSHA does support vaccinations for workers and the public, and that's basically under the president's executive order. We definitely do support the vaccinations.
Okay, thank you. So I guess this question is related to citations and enforcement. And Larry, you did cover some of this, but I think it's worth asking again, is what type of citations or enforcement actions can come from this, given there is no emergency temporary standard and there is no COVID-specific standard?
Okay, sorry. Yeah, so the PPE standards, as I mentioned, and the record keeping are the most frequently cited. I'm looking at the daily report right now, and it looks like the highest number, 267 respiratory protection E1, 173 paragraph C1. These are providing respirators or appropriate respiratory protection. 88 for record keeping, not reporting probably a fatality or hospitalization. A1, 1904.39, 1904.4A, 91 citations, violations. 25, another respiratory protection paragraph, and 20. So it's all respiratory protection, some 1910, 132. And not on this list are, now, when we do cite respiratory protection for construction, this isn't shredded out here for the equivalent for 1926, but I think we cite 1910-134 for construction as well for the 1926.59, I think, or is that HASCOM? There's a few HASCOM violations too for chemicals used, and there's a medical access record violation. So these are what we're issuing, and we have several of the 5A1s also cited, so the general duty clause.
So the general duty clause is basically that employment and a place of employment which are free from recognized hazards that are causing or likely to cause death or serious physical harm. So
right, and
that's information. These are good, you know, different standards that folks can be aware of that OSHA is looking for when there's, you know, some demonstrable harm.
Yes, and that's the hardest one to enforce. The lawyers want to make sure that we're citing and we understand that we can demonstrate a hazard at the work site. In a lot of cases, we see a hospitalization or a fatality, that the employer is aware of the hazard, that this is related to the work site. That's where this worker got this. It's work related. We can collect evidence that there was indications of work relatedness, like a worker was diagnosed, tested positive, but she worked on the work site the day before, or she was allowed to come to work even with a positive diagnosis. We've had cases. And then there's a feasible means of abatement. By doing some screening, they may have been able to prevent this. So these are the thresholds that we have to meet to issue a citation for the general duty clause.
Yeah, it's a really high bar. I agree with you. So they're probably not very frequent as compared to some of the other violations.
Correct.
That
yes.
You're
Scott is reviewing these. They come to the national office, and they need the national office approval before issuing.
So just as a kind of, the guidance really differentiates that your national office has put out guidance on COVID between masks and respirators. I don't know if you had any commentary on how that relates to the citations that you see in the Directorate of Enforcement. I guess, is there any confusion? Are these about mask wearing, or is this about respirator wearing?
Well, in a lot of our cases, especially for healthcare, where they are doing procedures where they're required to wear a mask, and in some cases they didn't have adequate supplies because the supplies were used up. But CDC is providing guidance on how to prioritize wear of respirators. But in some cases, just face coverings. We have issued citations. A couple cases, there was one in the news just this week. In Massachusetts, a tax service didn't believe in the COVID protection from wearing a face covering and wouldn't let her employees wear face coverings, wouldn't let her customers coming in to prepare their taxes. And that was actually a willful violation that we've issued under the general duty clause. That's a very rare event because there was clear knowledge from her state, her county, her health department telling people to wear face coverings. The CDC, she just ignored it. She didn't believe it was real. And we issued this citation. There was another case down in Atlanta where an iPhone repair store, the employer wouldn't let his worker wear face coverings, wouldn't let customers come in to have their phones looked at, wear face coverings, and he was issued a violation for not following the CDC guidance and the local guidance and the state guidance.
I actually did get alert on my phone this morning on the case of the tax company in Massachusetts. So I just pasted an article about that if anybody's interested in reading about a newspaper article about that particular case. I just pasted that in the chat for anybody to take a look at. Well, thanks. So I'm going to go on with some more questions. This is an interesting one. What are the chances of a fully staffed OSHA so that the agency can fully investigate safety complaints?
I'll take that one, Chris. As you know, staffing's always is always being brought up. OSHA is currently reviewing the staffing levels, and we also looking at the appropriations from Congress related to this issue. There are efforts to hire from some of the vacancies that are ongoing now. On OSHA.gov on our website, there is a link to, it's a hiring link that leads to USA Jobs. And I believe we have about a dozen currently listed there. And if you look at them, there are several whistleblower openings, there are some scientist openings, and some safety openings. So we are currently reviewing it and taking it seriously.
I would highlight in there as well, the Directorate of Construction has 5 vacancies advertised right now within our Directorate of Construction for construction safety specialists.
All right, let's get you staffed up. So here's a question. If employers are following the protocols as listed in the National Emphasis Program, would they likely be in compliance for a potential emergency temporary standard?
Well, we are aware that the emergency temporary standard would now become enforceable, and the NEP would still apply. We would just be enforcing that. So what we would do is we would develop a compliance directive all about those emergency temporary standards to go along with the NEP. So the NEP will still apply because we're targeting those same industries, but the compliance requirements for all these provisions in the ETS, and we've already started this draft directive. So our plan is to issue this very close to a time after the ETS is issued, and there's probably going to be some time period for employers to get familiar before the compliance date takes effect, but it's probably going to be short. But so that's why we're working in advance on the compliance directive.
Well, speaking of the ETS, there were a couple questions regarding the emergency temporary standard, and one was that they had heard that the Labor Secretary, the new Labor Secretary, Marty Walsh, had put it on hold. Another question is, can we expect an ETS? So what is the kind of official line from OSHA on where you are with the ETS or not ETS?
I'll go ahead and take that question. The current status of the ETS, as we said before, is under review. And since it's under review, it would be premature for us to speak for the Secretary of Labor. I think his words hold what he said. He said it is under review. And I do believe that, well, I know that when the time is proper, when the standard or the consideration process is complete and the review is complete, I'm sure you will hear from either the Secretary of Labor or Deputy Assistant Secretary Jim Frederick or someone from OSHA leadership very shortly.
All right, thanks, Scott. This question is a little bit more complicated, and I know that y'all have thought about the best way to answer it, and it's a specific question. So what's the current recommendation for social distancing while in-person training? We have a 12,000 square foot shop. approximately 20-foot high ceilings, roll-up doors, plenty of ventilation. Is it still 6 feet and a face covering?
Okay. So yeah, 6 feet separation is the guidance if you can't be within 6 feet. And indoors, face coverings. So partitions can help, but we're finding transmission around partitions where they're not properly used or properly placed. So it's important to follow the latest guidance that we've issued and that CDC has issued, looking at the hazard assessment. But especially indoors, even with a large building, there are things to consider like ventilation, fans. So that's the employer's responsibility to do that hazard assessment. But a large facility like that, they should be able to do 6 foot distance with workers.
Yeah, you would think so. So I just wanted to put a plug in now. You know, CPWR has our own guidance that we issued over a year ago now that does call for that 6 feet between workers, and when that can't be maintained, respirators should be used. And we haven't deviated from that as our federal government slowly comes around to talking about airborne transmission, because at first everybody thought it was just droplets, which don't travel very far in the air. So, you know, we still advocate for good distance and respirators when that can't be maintained, particularly on job sites and confined spaces and stuff like that. While I'm plugging, you know, CPWR continues to populate and keep current our construction COVID clearinghouse, and I think Jess can put a link up there for our clearinghouse. And we have an exposure control planning tool, which allows employers to develop a plan for their own businesses on how they're going to keep workers safe and assess the hazards on their job sites. And these are all out there for free and you know, developed to assist the construction industry and keeping workers safe while we continue to work through this time. Those are the questions that came in during the pre-registration process. There were some that really do not, they're not in OSHA's wheelhouse. Things like vaccine passports and questions about the vaccine. But I think there are a couple that have come in during the chat and in the question and answer that I wanted to ask, and some of these might be a little bit tough, but I think they're really valuable information for the industry can get. And one is, and I'm hoping, Larry, you can answer this, is how do you determine if a COVID illness is work-related or not for record-keeping purposes?
Yeah, that's a very difficult question. We do interviews of employees. We look at some cases medical records, and we it's not an easy determination, but we use a reasonable test to determine if it's likely. In many cases, the employee does acquire it's likely that it acquired outside of the workplace and then brought it into the workplace. In one case, I can remember a grocery store where the worker was in the cashier's cage with 2 other workers, and she was having some illness symptoms, some COVID-like symptoms, and they were wearing masks, but they were in close contact. They weren't 6 feet apart. And she went home that day, and subsequently she got tested positive. The next day, or that evening, the employer cleaned the cashier's cage, and the employees came back. The same two employees came back and worked the next day, and they ended up getting COVID. And the question was we looked at whether he was actually cleaning properly, because he was cleaning and then wiping off. And some of these cleaning disinfection products you have to let sit for a few minutes to disinfect. So that's something that we looked at. The other thing is, it's very likely that while she was having symptoms, even though she was protected with a face covering it, but they were so close together, it's likely there was some transmission there. So that was a difficult one for us to view. And in cases where we cannot make a clear determination of the work-relatedness, we issue a hazard alert letter, and we tell the employers, look, this is the guidance. We didn't have enough evidence to issue a general duty clause, but we think you could do better at your work practices and your protective measures. And in this case, use a better cleaning method, follow the directions, use an EPA approved disinfectant, things like that. So
I think you kind of reinforced a point that you made during your presentation, that it's a very high bar for OSHA to issue a general duty clause violation. And sometimes, all the facts can still point to the hazard existing, and yet you don't have enough evidence to issue the violation and have it hold up on appeal, right? I mean, that's
right.
kind of the way the general duty clause works. It's a super high bar. And so, my commentary is we're going to have a lot of hazards unabated because you can't make it stick, and it's really hard to make it stick. So that's my commentary. That's not OSHA's words. This question actually did come in early. I wanted to ask it. Can you describe how the new leadership at OSHA is going to build relationships with businesses moving forward?
Appreciate it, Chris. In particular, OSHA's leadership is currently and always working to manage the issues confronting America's workers in a proactive manner through using three methods: ensuring strong, effective enforcement, developing standards and guidance that work to enhance workplace safety, and continuing to build upon relationships developed with the regulated community and stakeholders. We have done this, and we are continuing to do that moving forward to address significant hazards in the workplace and making sure that we engage stakeholders and get input.
Thanks, Scott. This question came in during the webinar, and it's for Larry McGowan. You mentioned some numbers on retaliation against workers and said they were significant. And I don't know if, paraphrasing the rest of the question is, can you tell us anything more about retaliation against workers and what you're seeing from the perspective at the National Directorate of Enforcement?
Yeah, there's on our public webpage, we have lots of data. And if you go onto, you can find a link for the whistleblower data specifically. So there's lots of, we've received lots of whistleblower related complaints as well. It's not near the number of 17,000 of regular safety and health complaints, but I think it's in the thousands. The enforcement actions for whistleblower, I think we've only had 14 investigations in the past year. And I think all of them have been closed out. 2 are still ongoing. A lot of them have been related from Postal Service employees. So that's just a little snapshot of that whistleblower side. There's another directorate in OSHA that does all those investigations. We have whistleblower investigators in each of their regional offices that address these complaints and do their investigations. Generally, these are done remotely to keep the investigators safe and the complainants safe.
Yeah, and Larry, the link right from the Corona web page in OSHA, they have an enforcement link for the inspections, complaints, referrals, but right next to that is the whistleblower link, as you mentioned, and they're showing about 5,180 plus complaints for whistleblower. But
So,
all that information is available right on the webpage.
okay, thank you. Another question that's come in is, how can you find out if your state adopts this national emphasis program?
Well, the website for the Office of State Programs has a link on it for all of OSHA's federal programs, whether the state has adopted, and so you can go to that webpage, and maybe we can send that link at some point to show that. And so within the time period after the states have to notify us, we'll probably be posting that information.
Mm.
Right, thank you. This question came in through a private chat. So the question is, if OSHA during an inspection cites the employer and then in turn the employer writes up the employee for violating company safety policy, would that be considered retaliation?
Yeah, so you're getting into the legal realm, but employee misconduct is one of the defenses that employers often use. And so that is looked at closely to determine if the employer had a policy, whether what is an appropriate policy. And, you know, those investigations are very intricate in that they look at all of these issues. And with COVID, it's also difficult because employees may want more protection, and the employer has to be interviewed to see what he provided as far as protection. And the guidance from the CDC, as you noted, Chris, initially has changed on what's the best protection. So what is the employer's responsibility to, if the employee wants a certain level of protection and the employer only offers this level of protection? So all those are very complicated questions that the attorneys look at.
I would just add, Larry. Oh, yeah. Go ahead, Tim.
I was going to say, when in doubt, call the area office and speak with one of the whistleblower investigators, and they will look into it.
Yeah, I would add, having been in the field for 20 years prior to coming to the national office as well, that an investigator would have to take into account the policies and procedures of the company, but that would certainly draw attention if an employee was removed from a position or fired or let go or anything that could be in the area considered retaliation. And certainly, as a compliance officer doing the evaluation, you would have to consider that, and it would certainly be something that we would more than likely do a referral to a whistleblower investigator as well to do concurrently along with the inspection to make sure that we evaluate all the factors. And as usual, as Larry was going along the lines of, we want to make sure that we get the evidence correct, and every fact pattern is a little bit different in each case. So we'd want to evaluate it to make sure that there is a linkage to this, and it's unfortunately a terrible situation when that happens, but it does happen, and we are prepared to deal with that.
And just for a general understanding, the whistleblowers are separate from a compliance officer out there doing the inspection, so they will not be the same individual.
Great, thank you. One other question came in privately, and it asks about federal agencies or other branches of the federal government. Are they part of the NEP, or are they subject to it? Say, if you work in the Department of Veterans Affairs or somewhere, does this apply?
Yes. Yes, this applies. And one of the targeted industry is correctional institutions. Of course, because of the close proximity of prisoners and guards and workers, we've had lots of transmission in these facilities, but OSHA doesn't have jurisdiction over state and local correctional institutions, and federal agencies have jurisdiction over the federal prisons. One of the industries are contractor-run prisons, which currently isn't in our targeting scheme, but we may look at that when we address this NEP. We're going to do another evaluation in 6 months and maybe at 12 months. But yes, federal agencies are included in the program.
So there's a series of questions about, are masks needed? Is social distancing needed? And I think you've pretty much answered those, but there's another flavor here. So in two questions, I'm kind of looking at trying to figure out how to ask. How do you advise employers to deal with COVID fatigue? Number one, difficulty enforcing mask use, difficulty enforcing social distancing. And another person asks, how does OSHA address workplace conflicts that are arising due to misinformation on mask usage and vaccines? I wonder if there's any advice or any perspective you can give on these issues of COVID fatigue, misinformation. Have you seen workplace violence issues come up on this? It's a tough one.
Well, I'll take a stab at the COVID fatigue. And as with any of the safety rules, executive and leadership has to enforce them. But in order to get them to really work, we need worker involvement in it. And is there a way that the company can sit down, discuss with the workers what problems they're having with the masks, but also what solutions or face coverings, what solutions can they offer, and listen to what they're saying. Because if the employees are the ones that need to follow these regulations, their input should be valued. And I don't have any information. You mentioned the workplace violence. I don't have any input on that.
Yeah, I would agree that, as far as employee involvement and having work practices that are flexible, but yet maintain the reasonable protections against COVID. I think the involvement side, I'd just like to reiterate that I think that is key to it. Constant involvement and having discussions with people about these issues before they become problematic, not after they become problematic. You need to be on it right from the beginning and constantly adapt to the situations in the workplace.
And sometimes reinforcing that the 6 foot social distancing, the face coverings, and the cleaning aren't separate issues. these are a system that work together. And if you pull one of them out of the equation, the system doesn't work. So by explaining how the system works and why those procedures are in place, sometimes they just need a little reinforcement in explaining why they're there.
All right. So with that, I wanted to thank our friends from OSHA for participating in today's webinar and for dealing with some of these tough questions, some that weren't expected. Got Tim Irving from Director of Construction, Larry McGowan from Director of Enforcement Programs, and thanks Scott Earnest, my partner in these webinar series 19 up to for COVID-19. So please check out all of our past webinars. They're all recorded and available on demand, and this one will be shortly. Thanks so much. Have a great day.